Okay, so welcome to this next video in which we are discussing the drug treatment of rheumatoid arthritis. Okay, so we're currently looking at the pathogenesis of rheumatoid arthritis, and we're looking now at the fact that once synovitis has occurred, you're going to get a whole host of new adaptive immune responses being initiated against citrullinated proteins which are within the synovium that previously were protected from the adaptive immune response, which had lost its tolerance to these proteins, but they were protected because they were in the synovium and there just wasn't any cells that were going to actually be numerous enough to mount an adaptive immune response against it. But now we've brought in all of these new dendritic cells, and they're all going to be phagocytosing these citrullinated proteins, and they're then going to find CD4 positive naive T cells which have T cell receptors complementary to certain fragments of these antigens. Okay, and the dendritic cells also express co-stimulatory molecules. How, we don't really understand, but they do, and that activates the receptors for those co-stimulatory molecules on the CD4 positive naive T cell. So the CD4 positive naive T cell receives both signal 1 and signal 2, which triggers it to produce interleukin 2 and also the interleukin 2 receptor alpha. The interleukin 2 receptor alpha joins the interleukin 2 receptor beta subunit and the interleukin 2 receptor gamma subunit to make a full interleukin 2 receptor, and the interleukin 2 binds to that, activates it, and that triggers signal 3 within the cytoplasm of the CD4 positive naive T cell. Now what's going to happen is that CD4 positive naive T cell is going to firstly differentiate, and then it's going to proliferate. So let's see what's going to happen once it has received signal 3. So let's draw the CD4 positive naive T cell here. So this is CD4 positive naive T cell. Okay, and firstly what's going to happen once it's received signal 3 is that it's going to differentiate firstly. Okay, and it's going to differentiate into a cell type known as a T helper naught cell. Okay, so this is differentiation, which is a massive great word. Okay, and it's going to differentiate into a T helper naught cell, which is often abbreviated to T for T cell, H subscripted for helper, and then 0 normal scripted for T helper naught. So this is a T helper naught cell. Okay, then what's going to happen is this T helper naught cell is then going to proliferate. So the next process is proliferation. So it firstly differentiates from a naive CD4 positive T cell into a T helper naught cell, and now it's going to proliferate and it's going to make a whole population of T helper naught cells. Okay, so here we have our whole population of T helper naught cells. So I'll draw 3 of these, but in reality, of course, you're going to make thousands of the things, if not millions. So you've made a huge, great population of identical T helper naught cells which all have this T cell receptor which is primed against a certain fragment of that autoantigen, which was some citrullinated protein present in the synovial membrane. Okay, now what used to be thought is that these T helper naught cells then differentiated into T helper 1 cells, okay, and you got a typical cell-mediated response. However, now what is emerging is that most of them differentiate into a different type of T helper cell. So mainly what's going to happen is these T helper naught cells differentiate into a cell type known as a T helper 17 cell. Okay, but what used to be believed is that they differentiated nearly all into T helper 1 cells. But in reality, when you actually look in the synovial fluid and also in the synovium, you find very few T helper 1 cells, but you do find some. So some of them will differentiate into T helper 1 cells, but the majority are going to differentiate into these T helper 17 cells. Now, the factors which are responsible for them differentiating into these different types are interleukin 12 causes T helper naught cells to differentiate into T helper 1 cells, and there are two main cytokines that cause differentiation into T helper 17, which are interleukin 6 and also transforming growth factor beta, TGF beta. So these two cytokines are going to cause the differentiation of T helper 0 cells into T helper 17 cells. And as I say, most of these T helper 0 cells in the adaptive immune response to rheumatoid arthritis are going to differentiate into T helper 17 cells. And the importance of this is going to be reflected in the fact that one of the anti-rheumatoid drugs that has recently been produced is an monoclonal antibody targeted to interleukin 6 known as tocilizumab, but we'll come back to that later. Okay, right, so what's going to happen is that you've produced this population of T helper 0 cells which have T cell receptors which are complementary to a certain an antigen fragment of this autoantigen which was present within the synovium. Okay, and these are now going to differentiate into these T helper 17 cells. Now, what are these T helper 17 cells going to do? Well, they're going to do two things. One thing that they're going to do is they're going to go into the synovium and into the synovial fluid, and they're going to trigger the differentiation of monocytes into osteoclasts, and those osteoclasts are then going to degrade the bone, basically, the bones that are involved in this inflamed synovial joint. Okay, but T helper 17 cells are also capable of helping B cells. Okay, they're also capable of launching the humoral adaptive immune response. Now, generally, we think of the job of helping B cells as being done by T helper 2 cells, but in reality, T helper 1 cells, T helper 17 cells, and T helper 2 cells are all capable of helping B cells. Okay, so what's going to happen is you're also going to get the activation of the humoral adaptive immune response against these citrullinated proteins that we're launching these adaptive immune responses against. So, we need to now discuss B cells. So, let's move over from T cells. We'll come back to T cells. We'll come back to the T helper 17 cells after we've discussed B cells, because these are going to be involved in helping B cells. So we're going to start off with their role in helping B cells in their activation, and then we'll come back to talking about how the T helper 17 cells are going to activate the differentiation of monocytes into osteoclasts, which are then going to degrade the bone. Okay, so let's say this is a B cell. Right, so B cells have on their surface a membrane-bound version of their antibody. Okay, so all B cells have a slightly different antibody. Okay, so I'll put this here. And they make a special version of it that is a membrane-bound version of the antibody, which they put on their surface. Okay, so all B cells will have different antigen binding sites for their antibodies, basically. Okay, now, when it wants to produce a membrane-bound version like this, firstly, the FC region that it chooses is IgM. Okay, and then it also adds on a special portion onto the constant regions of the IgM antibody of the immunoglobulin heavy chain, which allows the thing to be implanted into the membrane. So we put a little m in front of this to show that this is membrane-bound IgM. Okay, so this membrane-bound IgM is what's often called the B cell receptor. Okay, and the B cell receptor is often abbreviated to the BCR for short. Right, so what's going to happen if we're going to launch a humoral adaptive immune response against these new citrullinated proteins, which remember we called citrullinated protein 5 and citrullinated protein 6 here? Okay, basically you're going to have B cells present which have a B cell receptor which has an antigen binding region which combines to epitopes on these antigens. Okay, so we were using citrulinated protein 6, so I'll put citrulinated protein 6 here. Okay, and let's say that there is a B cell which has a B cell receptor which combines to a certain epitope of this citrulinated protein 6 here. Okay, right, so what's now going to happen is this B cell is going to endocytose the entire B cell receptor with the citrulinated protein 6 bound to it into a vesicle. Okay, so let me show this. So I'll draw this B cell now very large so that I can fit in a large vesicle inside, an endocytic vesicle. Okay, so I'll move this up a bit. So this is our B cell here. Okay, and you have this endocytic vesicle inside the B cell, which has this membrane-bound form of IgM, which we're calling the B cell receptor, in its membrane. And this B cell receptor has now bound to its antigen, which is this citrulinated protein 6, which is now going to be squashed in here. Okay, there's the citrulinated protein 6. Okay, and now what's going to happen is that the B cell is going to break down the B cell receptor and the citrulinated protein 6 into fragments, and it's going to present these fragments on MHC class 2 molecules, just like the dendritic cell originally did. Okay, so it may well get this exact same antigen fragment that our dendritic cell had launched an adaptive immune response against, and therefore which all our T helper 17 cells have a T cell receptor which is complementary to. Okay, right, now the B cells will also put co-stimulatory molecules on their surface, just like the dendritic cell. Okay, and again, where these co-stimulatory molecules are going to come from in the case of the B cell are a bit of a mystery as well, because they are activated to be expressed in the B cell for the same reason as they would be activated to be expressed in a dendritic cell, i.e. the B cell will have pattern recognition receptors which need to be activated by their associated pathogen-associated molecular pattern. Okay, and clearly in this case we are actually launching an autoimmune response, so there shouldn't be a pathogen present. Okay, so the pattern recognition receptor should not have been activated. Of course, there is a possibility that maybe you could have a concurrent pathogenic infection within the body, which actually is providing pathogen-associated molecular patterns, and potentially it's these pathogen-associated molecular patterns that are being provided by the concurrent pathogenic infection that are activating the expression of the co-stimulatory molecules on the dendritic cells and on these B cells here. Okay, so again it has expressed CD40 here, and also a B7 molecule, which is either B7.1 or B7.2. And now what's going to happen is it's going to interact with these T helper 17 cells. So it's going to find a T helper 17 cell, and it may not be a T helper 17 cell, it could be a T helper 1 cell, but we don't find many T helper 2 cells at all in rheumatoid arthritis. So we think it must be the T helper 17 cells. We do know that they are capable of helping B cells. Okay, so we think it must be T helper 17 cells that help these B cells in this case. Okay, so what will happen is the T helper 17 cells, of course, all have this T cell receptor which binds to this antigen fragment here. Okay, so their T cell receptor will bind to the antigen fragment. They also have a CD4 molecule here which will bind to the MHC class 2. So here is CD4 in orange here. And then they also have the receptors for the co-stimulatory molecules. Okay, so the receptor for B7 molecules is CD28, and the receptor for CD40 molecules is CD40 ligand. So this is CD40 ligand here, or CD40L. Right, now when you form this structure here, and by the way, this complex where all of the co-stimulatory molecules are bound to their receptors, and the MHC class II with the antigen fragment is bound to the T cell receptor and the CD4 molecule. This is what's known as an immune synapse, okay? And it was known as an immune synapse when we had the dendritic cell presenting the antigen fragment on MHC class II with co-stimulatory molecules as well. So this is an immune synapse, and you see it formed all the time in the adaptive immune response. Okay, but this time it isn't the T cell that's going to be activated by the formation of this immune synapse. It's going to be the B cell that is activated by the formation of this immune synapse. Specifically, this binding of CD40 to the CD40 ligand is extremely important in activating the B cell. Okay, so it's going to activate the B cell. Now, what is the B cell going to do? Well, basically, it's going to divide and divide and divide and divide and produce an expansion of the number of B cells. However, usually what happens is you then go through a process known as somatic hypermutation and affinity maturation. Okay, and this is where this becomes a little bit difficult, because where this is occurring is a little bit controversial, okay, as to whether it's occurring in a lymph node or whether it's occurring potentially in tertiary lymphoid organs that have been set up within the synovial joint. But what happens basically is that the B cell is going to divide and divide and divide and produce a whole population of B cells, but these aren't going to yet differentiate into plasma cells. Instead, you're going to get a process of natural selection occurring. Okay, so let me describe what's going to happen. Okay, so basically, these B cells that you're producing from your original B cell will not all be genetically identical. Okay, instead, they will all have slightly different B cell receptors, and the portion of the B cell receptor that is changing is this antigen binding portion up here, okay? So they're all going to have slightly different antigen binding portions of their B cell receptor, okay? Now, basically, this process where all of them undergo little mutations that change the antigen binding site of their B cell receptor, this is known as somatic hypermutation. Okay, so you get a process called somatic hypermutation where the B cells that are produced from this original B cell all undergo little mutations in the antigen binding site on their B cell receptor, and therefore they all end up with slightly different antigen binding sites on their B cell receptor. Now, that's the first step for this process of natural selection, because remember, in natural selection, what you need to start off with is variation within a population. So we've now got a population of B cells which all have slightly varied B cell receptors, okay, and all of these B cell receptors will have slightly different affinities for binding to the citrullinated protein 6, okay. So let's say this B cell here, which we'll call B cell 1, let's say B cell 1 has undergone a little mutation in its antigen binding site here, which means that its affinity for binding to citrullinated protein 6 has actually gone down a little bit, okay. And let's say B cell 2 here has undergone a mutation in its antigen binding site of its B cell receptor that has meant that its affinity for binding citrullinated protein 6 has gone up a little bit. Okay, and let's say that B cell 3 down here has undergone a mutation that means that its antigen binding site here has a massively increased affinity for binding to citrullinated protein 6. So this one is absolutely the best. Now, basically, we want to select for this B cell. Basically, the whole idea of this is that we're going to improve the affinity of the B cell receptor for the antigen, basically. So we now want to select this B cell here. So now we need to put a selection pressure that favors those B cells which have a high affinity B cell receptor for binding to the antigen. Okay, so basically we'll just set up the rule that if you bind antigen, you're going to get to survive, and if you don't bind antigen, you're not going to get to survive. Okay, so the ones which don't bind antigen, which will be B cell 1 and B cell 2, because remember there is a limited amount of antigen. Okay, there's only a certain amount of antigen, so the better B cells, the best B cells will get the antigen and they will bind to that, and the less good B cells, those will not get antigen. Now the B cells which do not get antigen, they undergo apoptosis, whereas the B cells which do get antigen, which in this case is B cell 3, those will undergo this entire cycle again basically. They will internalize the antigen. They'll present fragments on the surface of MHC class II molecules along with co-stimulatory molecules, and they'll get T cell help. And by the way, when you form this immune synapse with a T helper cell, this is called T cell help. Okay, and they will then be activated to divide and divide and divide and divide and divide basically, and all of their offspring will then undergo affinity maturation again. Sorry, somatic hypermutation again. So B cell 3 will divide and divide and divide and produce a population of B cells, all of which have B cell receptors, which are based on the B cell receptor of B cell 3. Okay, so what's gradually going to happen, if you imagine this setup now, what will happen over a long period of time, okay, is that the population of B cells will change. It will go from having B cells which potentially have quite low affinity B cell receptors for binding to the antigen, to having a population of B cells that have all extremely high affinity B cell receptors for binding to the antigen, because all of these B cells here will now have B cell receptors which were based on the B cell receptor of B cell 3. Okay, which was a very high affinity B cell receptor. And if you continue this cycle over and over again, you're going to gradually evolve the population so that your population of B cells all have very high affinity B cell receptors as far as binding to this antigen, citrullinated protein 6, is concerned. And this change in the affinity of the B cell receptors over time is what's known as affinity maturation. Okay, now it's not fully understood what happens to stop this cycle from occurring. I mean, if you imagine, it could go on forever, but after a certain number of cycles, or after a certain amount of time, some of these B cells undergo full differentiation, okay? Well, they don't undergo full differentiation initially. What happens is they differentiate somewhat, and they differentiate into a cell known as a plasmablast. Okay, now plasmablasts can still divide a little bit, okay, but they're not going to go through the same process as the B cells were going through. They don't have to, receive T cell help to survive anymore, okay, and what will then happen is these plasmablasts, which are coming out late, basically, so you've now got this population of B cells which all have very high affinity B cell receptors for binding to the antigen, and some of them will now start differentiating into plasmablasts. The plasmablast will divide a little bit and will then produce cells known as plasma cells. So maybe it will divide up into more plasmablasts, okay? So it will divide and produce more plasmablasts which all have identical B cell receptors to it. And these plasmablasts will then differentiate into plasma cells. Okay, now these plasma cells will go into the blood, and then they will go from the blood into the bone marrow, and in the bone marrow they will produce antibody, okay, that is targeted against this citrullinated protein 6. And of course the antibody is just a soluble version of the B cell receptor. Now it's also worth mentioning that during these rounds of affinity maturation that you go through, what will happen is you'll also potentially class switch, okay, so you can choose to change the immunoglobulin heavy chain constant region that you use. Initially you use the constant mu region, which gives you IgM forms of antibody, but you can switch to using a different constant region, and that will result in you producing different types of antibody, and then the plasmablast that you produce will produce that different type of antibody. Okay, so often they will class switch to an IgG form of antibody. The plasmablast will then produce IgG, and then the plasma cells will produce IgG, and this will not have the membrane binding portion. Okay, so you won't include that membrane binding portion, and therefore you'll produce soluble IgG that's targeted against citrullinated protein 6. So, basically, you've now initiated a humoral adaptive immune response which has resulted in the production of antibody that is against the new autoantigen present within the synovial joints. This antibody will then go into the inflamed synovial joint, bind to its antigen, and of course you've then got more immune complexes. Those will bind to Fc gamma receptors on the sentinel cells, and they'll also activate the classical complement pathway to release the anaphylotoxins, and both of these will activate sentinel cells to release pro-inflammatory mediators, and they will maintain the chronic inflammatory response that is occurring within the synovial joints. So it is thought that whilst synovitis is occurring, you're getting more and more humoral adaptive immune responses being initiated against a greater and greater array of citrullinated protein autoantigens that are present within the synovium. Okay, and this is this is one of the things which contributes then to the propagation of the inflammatory response in these synovial joints, and why it never ends, basically, because you just continue launching new adaptive immune responses against autoantigens, okay, which have had failures of immune tolerance. Basically, you've lost immune tolerance to these antigens. Okay, so that's the way that the adaptive immune response propagates the synovitis forward. And I should just add that a similar response to what I've just described would have occurred right at the beginning. Okay, when we were talking about the pre-articular phase, we talked about the production of these autoantibodies against citrullinated proteins that were appearing within the blood years before you ever got joint symptoms. That will have involved similar pathways to which we've described here. Okay, but now we're seeing how it's actually propagating the synovitis forward, and why it maintains this chronic inflammation within the synovial joints. Okay, so in the next video we'll look at how T helper 17 cells can also contribute to the actual destruction of the bones involved in the synovial joint. And I should just add that this pathway is controversial, okay? It may well change. We do not find a vast array of T helper 2 cells involved in rheumatoid arthritis. We do not find a vast array of T helper 1 cells involved in rheumatoid arthritis. We do find a vast array of T helper 17 cells, okay? And we know that now that T helper 17 cells are capable of helping B cells in the same way that T helper 2 cells would help B cells. Therefore, we think that they must help B cells and help to produce these humoral adaptive immune responses against new citrullinated protein antigens within the synovium that contributes to propagating the synovitis onwards into a chronic condition. Okay, so in the next video we'll turn our attention to the other thing that T helper 17 cells do.